Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752. Did we talk about the free book yet today?
Let's do it. So this is Dr. Marc Darrow on Living Pain Free. It's a show that will instruct you how to live pain-free in your musculoskeletal system. It's something that I've had for my whole life. I've had injuries since I was a little kid. I remember the first time I really got hurt. It was during recess in grammar school. And I wasn't a giant guy, and I was playing football, and I got tackled. And I was probably, 6, 7 years old. And the bell rang to go back to our home room. And I couldn't walk. I literally low crawled all the way back. And that knee from time to time has given me issues. So I started injecting it, when was it? More than 25 years ago. And it's doing great now. I run up in the mountains. I have meniscal tears in my knees, both of them. And guess what? They don't hurt. So be careful when you get an MRI or your doctor says you have a certain diagnosis, not to think that's an issue. Be very careful because you'll end up getting a surgery you don't need. All my orthopedic surgeon buddies would love to operate on my knees and my shoulders and everything else, but I tell them I don't have pain. I have had pain, but I've injected them and helped them heal. And this can be something that's possible for you too. So we're talking to Joe. And Joe, thanks for hanging with us over the break. You were told that your right hip may need a replacement, also that your knees are bone on bone. I disputed both of those things with you, not with you, but about the situation. And I won't really know until you come in. But I can tell you this, the threshold for doing surgeries for me is very, very high. I rarely ever have to send somebody to a surgeon. Occasionally, if someone has a terrible injury, I will do that just for a backup. But one of the most common things I see, Joe, as an example, is a lot of people come in with an AC rupture, from skiing. I just had one of those. Surfing, have those all the time in California. Basketball, you name it. ACL ruptures happen very easily. And the ACL is the anterior cruciate ligament. It's something everybody with knee pain should look up on Google, anterior cruciate ligament. When you go to Google and you find that, up in the left-hand corner it says images, click on that and you'll see photos of it or drawings of it. And you can see what's going on and learn your own anatomy. So when you talk to your doctor, you know what you're talking about. So what do I do when someone comes in with an ACL rupture? The first thing I do is I put my somebody's making noise. Is that you, Joe? Joe, are you with us?
I think that was my dog crawling into the back seat.
Oh,
that was his
so
right
cute. By the way, bring your dogs when you come in.
My baby's with me. She always is with me.
Good. Well, when you come into the office, please bring your baby with you. I love playing with dogs. I have greenies, these little treats that they love, and I run them up and down the hallways.
Oh, yeah.
And we have the best time. At any rate, so
if I can make it in the next 3 days before I have to go back to Oregon, then I'll do it. But
why don't you just come in Monday? Come in Monday. I'll get you in.
I can do that.
I will. I'm going to give you the phone number to the office right now. It's 800-300-9300, and I'll follow up with it after the show. I'll call you if I need to.
Okay.
To get you in Monday.
Okay, you've got my number, 800-300-9300. Let me write that down.
You call that number right now, yeah. But anyway, so what do I do with an ACL rupture? The knee-jerk reaction, that's a pun, Nita, is to operate on an ACL rupture, okay? And I see them all the time. Just had a patient come in with an ACL rupture. It's somebody who is an old buddy of mine surfing, and he didn't come to me. I don't know why. I mean, he's known me forever. He went to an orthopedic surgeon. They immediately replaced his ACL with a cadaver, and he ripped it again, okay? Now he's in Europe, and he called me up 2 nights ago, and he said, I really screwed up. I didn't think of you at the time, but now I'm going to come to you because now they want to do a third surgery, and I don't want it. So I told him I could help him. What we do is the first thing we do when an ACL ruptures, it bleeds a lot, and I put my ultrasound on the spot in looking in the joint, and if there's fluid in there, I will aspirate it out. And the nice thing about using an ultrasound and the way I do it, people don't even feel it. Most people who come and say I say we have to aspirate. They go, I'm not doing that. I did it once years ago with an orthopedic surgeon. It hurt like heck. So the way I do it does not hurt. I numb it up, and I have an ultrasound. I can see every drop of fluid inside the knee. And when we pull it out, if it's red, meaning blood, we know something ripped. Okay, so it's diagnostic. A lot of times there's no rip. You get an MRI, it looks like a rip, and it's not because MRIs are overly sensitive. So I take the fluid out, that starts the healing process, and then we'll put in some platelets, probably stem cells also, if I think there's a tear. And if a knee, for instance, blows up real quick with fluid, that's typically an ACL rupture. If it starts blowing up slowly overnight, that's typically more of a meniscal tear because they don't bleed as much. So there's different ways to handle things that are non-surgical that help heal people. I have plenty of people that are back at their sports after their ACL ruptures, and the ACL is not necessarily needed to hold the knee firmly together. There's also muscles, tendons, and other things that do that. So we do a test, a Lockman test, a drawer test. We see where the person's at, and there's way too many people that even after an ACL rupture have a great knee and do not need surgery. So be careful. So Joe, God bless you. I hope you come in, and we're going to go to Jim from North Hollywood. So Jim, Dr. Marc Darrow, how are you today?
Hi, doctor.
Are you living it up like we are?
I think I'm going to have surgery in August. I have
lower
back pain, and I get pain down my right leg.
Okay.
Is this a candidate for stem cell?
Good question. I have to examine you. The back pain, probably yes. The leg pain, maybe yes, maybe no. And sometimes when we heal the back, the leg pain goes away. If it's a true what we call a radiculopathy, where the radix of the nerve coming out from the spinal cord is pinched, then I may not be able to help, but I may be able to help. So often what I'll do is I'll fix the back. Once the back is fixed, sometimes the leg pain goes away. Same thing with the neck. Neck and the back are similar. You can have a radiculopathy, in the cervical spine that causes arm pain. But we have to be careful before a surgery and get an EMG, a nerve conduction study, because that'll give us an idea of where that paresthesia or tingling or numbness or pain is coming from. So I just had a gentleman come in who had hand pain, and he said his surgeon wanted to do a neck surgery. I said, that's jumping the gun. You need to get an EMG and a nerve conduction study first, because you could have many different syndromes. You can have an impingement at the elbow or at the carpal tunnel that causes those kind of symptoms that has absolutely nothing to do with your neck. So don't go get a neck surgery that's not going to work. Don't get any surgery that you don't.
They're talking about lower back.
Well, I know it's the same thing though. Same thing, neck or back. Yeah, I get that this is your back. I'm sorry?
I had the MRI, and the MRI did not look good.
That doesn't matter. If you've ever listened to me before, you'll know that you cannot trust an MRI to give you a good diagnosis. I like to get them because it gives me information. But I have people every single day in my office who have terrible MRIs, and then they're healed. I don't fix the MRI. And I'm one of them. My MRI of my shoulder showed 2 tears in the rotator cuff. I have a labral tear also. So there's 3 tears. I have no pain. I'm lifting my arm up, swinging around right now. I'm going to go play golf later and probably lift weights. Okay?
Great.
So don't think because a surgeon shows you an MRI that you need surgery. That's old school. If you want to do it, go do it. God bless you. But it's not something I would do.
Well, it's like a 3-month recovery period.
Well, look, I don't know what the recovery is. I didn't recover from my shoulder surgery that I was stupidly did in medical school when I didn't know anything for 4 years. And the only reason I recovered is because I learned about regenerative medicine, which is the field that I practice, and I was experimenting on my shoulder, and it healed overnight. That woke me up. Okay?
Well, I'm open to any suggestions. You want me to make an appointment at your office?
That'd be great. The number to the office is 800-300-9300. And Jim, if you want to actually watch me do these procedures, go to the website, www.jointrehab.com, or just Google my name, Marc Darrow. And you'll probably find like 20 pages about the work I do there.
You have it written down, yeah. I'm gonna log in a hot second here.
Yeah, I mean, it's a lot easier to get a couple of injections than to go through a surgery, which you're going to get plenty of injections, and then there's the risk of infection and all kinds of problems. If you saw the things I see walk into my office, you would never have a surgery unless it was something that was really major and it had to be done.
Yeah.
But unfortunately, the people that come to me have surgeries when they never had to have them.
Yeah. Well, if I could avoid it, I'd love to. But
Exactly. There's too many risks with surgery. With doing platelets and stem cells, there's very, very minimal risks. One of the big risks, if you want to call it that, it's a side effect where people often get a little bit stiff afterwards for a day. I can put up with that. You know, people laugh when they go, well, this isn't the right time for me to do this, blah, blah, blah. And I go, I do it between patients on myself when I need to. Then I continue seeing other patients. It's that easy.
Right. Okay. I'm going to call your office and see if we could talk privately. And
yeah. The number again for people listening to the office is 800-300-9300. If you give us a call today or at the office, we will send you out my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got about 250 scientific studies on how regenerative medicine of platelets and stem cells work, and that they do work even though your surgeons will tell you it doesn't work, and how the surgeries fail.
I've kind of been told they have to shave the bone a little bit. Does that make sense?
Well, look, I don't know you. I haven't examined you, and I can't comment.
Right. I understand.
Yeah.
It's like a car. You got to look at the car, not diagnose it over the telephone.
That's right. You got it, man. You're a smart man, Jim. Thank you so much for your call. We appreciate you. God bless you. Yeah, thank you. For anyone who wants to call in, talk to us live right now, get your pencil, write this down, the phone number to the studio, 866-870-5752. I'm going to repeat it, 866-870-5752. So let me ask you something, Nita. Are you ready to have some fun?
Sure.
You are?
Always. I'm always up for fun.
All right. You have your laughing voice on?
I do.
Here we go. Why shouldn't you write with a broken pen?
I don't think I heard that correctly. I think you said, why shouldn't I write with a broken pen?
Because it's pointless.
Oh, my God. That's a good one. I like it.
Okay, Nita, here's another one. You ready?
Okay.
Why can't you trust the king of the jungle?
Because you can't trust any kings.
Oh, no, that's not true.
I just thought I'd try anything.
Because he's always lying.
Oh.
Nita, you better write these down because I may hit you with the same ones next week.
Yeah, I know. I know. I was wondering, do you ever run out of them?
No, I don't. I love jokes. I love dummy jokes. You can't tell a real joke today because someone will be offended. But dummy jokes, yeah, these are great. These one-liners. Okay, Nita, this is your last chance. 3 strikes and you're out. You ready?
Okay, ready.
What did one wall say to the other?
Move over.
I'll meet you at the corner.
Oh, okay.
Okay, I'll give you one last chance. Bonus points. What do sea monsters eat?
Fish.
You're right. And ships. What do sea monsters eat? Fish and ships.
Oh, my gosh.
We
That's
won't
hilarious.
get into what happened with those poor guys that went down in that little submarine.
Yeah, that's very sad. That's tragic.
Terrible.
That's too
Let me
bad.
see what we got going on here.
Okay, so why don't we say what else is going on in the office, give a phone number.
Good point. So I use regenerative medicine on the head for people who have thinning hair, not baldies like Dr. Who?
Darrow? Did I answer that too fast? I'm so sorry.
Anita, you got me back. I was going to say Dr. Phil and skate. Yeah, I'm not going to do it on my head either.
Okay.
But for people who are thinning, it's a great thing to do. You just put some platelets in their stem cells and it reawakens and fortifies the follicles and the hair thickens up. And then it can be done on the face. That's right. For those people who are wanting to look more beautiful or more handsome, it regrows the collagen in the face. And as we age, we kind of dry out. And as we know, people get shorter because the discs in the spine start to dry out. And that's called degenerative disc disease. But the same thing happens in the face. People start looking a little gaunt. We do a few little injections. We numb it up and do some injections. And that actually grows back and people look amazing. Well, I'm going to get to some other questions here if I can find them. Let me see. Yes. Okay. So here's one on fingers, thigh, and buttock pain. That's a lot of stuff. Okay. I have terrible pain in my fingers. They're getting deformed. Also pain in the right top of my thigh under my buttock. And I'm being treated for osteoporosis every 6 months with Prolia. I'd like to make an appointment with you. For an appointment, just call the office at 800-300-9300. That's 800-300-9300. Well, let's start with pain, top of the thigh to under the buttocks. That is where the hamstring muscle is attached to the ischial tuberosity. And you can look that up. That's the bottom of the pelvis on the back. Ischial tuberosity. Go to Google, look it up. And on the top left of Google, there's a spot that says images. Click on that and you'll see what I am talking about. Very, very common type of an injury or overuse syndrome. I have had it personally, and it goes away very easily using regenerative medicine of platelets and stem cells, even if there are tears there. I've had many, many people that have these small tears there. We get an MRI, we see that, and we can help that too. So one of the things that is common for that is when people are driving, when they're in that sitting kind of position for a while, that place starts to really ache badly. But it's an easy fix. I had a surgeon come in who's one of my greatest proponents. He sends me tons of people. And he had that. It was torn. And he came and said, "Do you think you can fix that?" I said, "Oh, that's a pretty big tear, but we'll give it a shot." Anita, you're not laughing. So, Anita, come on.
You always give shots. That's not funny. That's normal.
Well, I said I'd give it a shot. Anyway,
I think
so
that's cool, though.
it's called a pun. So
Oh,
I said, we'll give it a shot. So he said, yeah, let's try it. I don't want to have surgery back there. I'm too busy. I'm operating. I'm on my feet all day long. I don't have time to take off, a month or so while it heals after surgery. So we did that. He healed up, and he has sent me endless patients after that. So surgeons are great guys. They don't usually come to see me, but I do get a bunch of them. And when they heal, they are the ones that send me the most patients because they really believe in this stuff when it works on them. So yeah, that's an area that can heal up. The finger deformities, that's probably osteoarthritis. I don't know, but that's the most common form of arthritis in the fingers. It could be psoriatic arthritis or other forms of arthritis, and that's something that we can often heal up very quickly also. The deformities typically don't go away if the finger is crooked, but if it's just little lumps on the fingers, those often do go away. Those nodules will usually go away. And I find that all over the body. Sometimes people have, swelling around the ankles, and we can inject that. And this is not swelling that comes from heart disease. This is swelling that comes from the ankles having been fractured or the ligaments being sprained or torn. It's very common for swelling to remain, and then we inject around there, get rid of the pain, and then the swelling often goes away. And one of the reasons that works is because when I do the regenerative medicine of stem cells and platelets, there are white blood cells that go to the area, and the white blood cells chew up all the junk. They're very good at that, and they help heal. Okay, so the last thing on this person is they're being treated for osteoporosis with Prolia injections. I like to treat osteoporosis with hormones, hormone supplementation of testosterone, and that's for men. Yeah, men get osteoporosis, same as women, because their testosterone goes into decline, and women, their estrogen, progesterone, and testosterone goes into decline. So women typically will need all three. I've had women who have been in severe osteoporosis who have grown back their bone in a year of supplementation. Okay, so that's something else that I do in my practice. And I am 75. I have been taking testosterone injections and cream. I've done it different ways for the last 30 years. I was diagnosed with, I did it myself, my energy was low. I tested my testosterone, and that was back when I was a resident at UCLA. And I was wondering, why am I so exhausted? My testosterone was low. I just naturally lost my testosterone at a very early age, and I started supplementing. And at that point, I knew I should get a bone density, and I had close to osteoporosis. It was called osteopenia. People come and they go, I only have osteopenia. It's not osteoporosis. There's not a big difference. If you have severe osteopenia, that's pretty much the same as osteoporosis. So I started taking testosterone back then, and my bones are almost back to normal again. I do a bone density every few years now, and I have the bones of a young man again. If you have osteoporosis, there's a high probability of a hip fracture, and 33% of people with hip fractures who are, quote, elderly die. Here's the break, the big break.
This is goodbye break.
The bye break. Thank you, Nita. Thank you, Suzette and Alex. And if you want to get to my office, call 800-300-9300. If you want to watch me doing these injections of regenerative medicine of stem cells and platelets, go to www.jointrehab.com. We love you all, and thank you so much for tuning in and listening to the show.
Thank you, Dr. Darrow.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life. Call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.